This is my 15th video, and I'm sure there'll be a lot more than this, on my continuing coverage of the health care bill. And I know this has been a long time coming. I've had to do a lot of research on this. Alright, the next section we're going to cover is found on page 17 of the health care bill. And we're first of all going to say that what we're doing here is we're developing reporting requirements. Now, who is developing these reporting requirements? Well, in the next couple of years, the Secretary of Health and Human Services, in conjunction with the experts in healthcare quality, they're going to all come together and they're going to develop these reporting requirements. Who's going to use these reporting requirements? Well, group health plans are going to use these reporting requirements, and health insurance issuers are going to use these reporting requirements. And who are these health insurance issuers? These are people that offer group or individual health insurance plans. Okay? Now, what are these reporting requirements regarding? They're regarding plan or coverage benefits, and also health care provider reimbursement structures. Now, for those of you who do not know what a reimbursement structure is, this is what is involved when you go and you see a doctor. The doctor doesn't immediately send the bill to you. He first sends it to your health insurance provider. And then, when the health insurance provider pays him, then he sends whatever's left in the line of a bill to you. Okay? Alright. So, this is involving reimbursement structure. Well, a reimbursement is when the doctor gets money from the healthcare provider. Okay? He's going to get reimbursed for his services when he medically treated you. Alright. Now, what about these reimbursement structures? Well, here comes a big time problem. The problem is, what they're trying to do is trying to prevent you from being readmitted into the hospital with a chronic illness. And a good example of those kind of chronic illnesses is chronic obstructive pulmonary disease. And you can look this up for yourself. I'm not going to look it up for you. But chronic obstructive pulmonary disease is a chronic illness, and they don't want you going back to hospital periodically for this illness when they have ways of treating you there at your house or at some nursing facility. Okay? So that's their real goal, is to keep you from being readmitted in the hospital. It'd be a lot cheaper if you were at a nursing home or at your house treating yourself than having to go to the hospital all the time. Alrighty. So what are going to be in these reporting requirements? These reporting requirements will report ways to improve health outcomes. Okay? Now, what these reporting requirements are going to do is you're going to have these reports that are going to show people how effective a health insurance provider is in keeping you from going to the hospital on a regular basis. Okay? So improving health outcomes, they're going to come up with quality reporting, effective case management, case coordination, chronic disease management, and medication and case compliance initiatives. Now, there is a reference in the healthcare bill on page 17 about the medical homes model. And what is the medical homes model? This is where you have a primary care physician. Okay? I have a primary care physician. This is my regular doctor that I go to on a regular basis. This guy knows my medical history. He knows me. He's met me. He's talked to me before. I'm sure we're going to talk again, so on and so forth. But he and I know each other. I know his name. He knows mine. He knows what I've been through, what I'm going through right now, and if I have another problem, I can go to him. He'll keep an eye on it and make sure it doesn't become a chronic problem that gets me sent constantly to the hospital. Okay, so that's what's meant by a medical home model. Okay. Now, in a medical home model, which they're going to be developing on this healthcare bill, you're not only going to be able to deal with your doctor in his office, but you're going to be able to email him and communicate with him over the web, and he's going to be able to help you and consult with you and treat you without you having to go to the emergency room all the time and being admitted to the hospital on a regular basis. So that's what's meant by a medical homes model. Okay? Now, this reporting requirements thing is also going to show how effective a health insurance provider is in implementing activities to prevent hospital readmission. Okay? When you're discharged from the hospital, they're going to have the nurses and the doctors go one-on-one with you in a line of a counseling session to make sure that if you're on some kind of medication, that you're taking it properly, that you understand how to take it, when to take it, so on and so forth. If you have to change bandages on yourself, they'll tell you how to do that and make sure you're doing it correctly, that kind of thing. It might take you a little bit longer to get discharged from the hospital doing that, but if you're doing things the way they tell you to, you won't have to go back in. That's the key. And if you're not able to do it yourself, they can talk to somebody who can help you do this. Say you have a best friend or a relative that can help you change your bandages or make sure you're taking your medicine, that kind of thing. And that saves them on a big bunch of costs. Because I'll tell you something, it costs more to have you placed in the emergency room than it does for you to treat yourself at home. And believe me, you can treat yourself at home. I know for a fact you can treat yourself at home because I do it on a regular basis. So if you do what the doctor tells you from the beginning, most likely you'll not end up back in the hospital. And that's a good thing for healthcare providers. They want you to be able to take care of your stuff at home so they don't have to cough up thousands, if not millions of dollars. And if they don't have to cough up thousands or millions of dollars, then that saves everybody on the group health plan. Okay? The less burden you place on the insurance provider, the more benefits they're going to be able to give to you when you really need them the most. Let me tell you something, you really need a health care provider when you've broken your leg or say you accidentally fall down a flight of stairs. That's when you really need a health care provider. Chronic illnesses, if you do what the doctor tells you, most likely you're not going to have to be readmitted in the hospital. Now, that's no guarantee. Sometimes extra things develop and then you do have to go to the hospital. But the less time you're in the hospital, the less burden you are on the health insurance provider and the more services they can offer to you at a more affordable cost. Okay. That's what I'm going to talk about in this video. I'm going to talk about more in the next video, so stay tuned.